want to thank you for coming onto the podcast. I'm excited to meet you and finally talk about some of the things that we've been talking about. You're
Yes.
Dr. Roxanne Richards.
Yes. Great
You
being here.
are based in New York, Long Island, is
Yes,
it?
Long Island
Okay.
area,
hmm
and also I practice in several states as well. So
Okay.
yeah,
That's awesome. And so you have your own practice called Hope Behavioral Health. And
it's actually Hope Behavioral Care.
I'm sorry, Hope
Yes.
Behavioral Care.
Mm-hmm.
And so that's based in your office is in Connecticut, but you work with clients.
I work in clients all over, mainly in Texas, in New York, and also, of course, Connecticut.
Okay. And so tell me a little bit about the practice and where what you focus on and how long you've been doing this type of work.
I've been doing this kind of a work pretty much forever. But I started my practice
Right.
back maybe 6 years ago.
hmm
And the kind of work that I do individual therapy, I do group work, and I also do a lot of events. So I do several topics that people request. I do presentations to assist people with different issues that they are faced with. So
hmm
yeah.
Now in this day and age, because I mean, it is a case that a lot of people, because of resources and because of exposure, do seek out therapists on their own, but we still have various communities of people out there, for example, who will not seek those services out. In fact, I interviewed a therapist probably a couple of years ago who told me that most of the people who come to her are referred, from their doctors or their caseworkers or whatever, and a lot of them go unwillingly. Is that still like the case, would you
That
say?
is still the case. I mean, unfortunately, people do struggle a lot, and especially post-pandemic, you have a lot of people who are actually struggling, and therapy is it's relatively new to some people,
Yeah.
and there's still a lot of stigmas associated with therapy, especially you have some groups in the Caribbean that's big stigma for them. So therapy is a big deal. It's a new thing for them. So it takes a lot of a push, a lot of motivation and encouragement for somebody to actually go into that space to get the support that they really truly need.
hmm Tell me about that stigma. Why do you think that stigma exists, and what is it about therapy that some people are like, I don't want to mess with it?
Yeah, so that stigma it exists because for some people, especially if you're coming from a place of faith, for some persons they believe that hey, it's a lack of faith to depend on therapy, or actually, for some persons, it's another thing. It could be just a fear of being able to open up their inner concerns, their hidden issues with somebody else. So that's something that's especially for some men. I know that's a challenge for them to really and I would say that because I'm coming out of the Caribbean. So I know that that it's definitely a struggle for some men to be that open
Mm-hmm.
because of the role that they do play in their homes. They play that dominant role. They're supposed to be the ones that care for their family. It can be it can be very humiliating for them to be, it's a sign of weakness, and that's not something that they want to feel, that they're actually having that particular struggle.
Mm-hmm.
So for some men in some communities, that is a big deal for them. So there's stigmas associated with that. So that in itself, it's something that we have to really help people to break those barriers and those beliefs that keep them away from that kind of a support that you
It's
need.
interesting. I just thought of something because I would imagine if you're a man and you feel there's a stigma about you going to therapy, um, and you're married, you have your wife, your kids. Um, is it ever appropriate for a man to seek out a therapist or you, for example, and not tell his family? Like,
Well, it is it's really a very private and
yeah,
confidential place to be at to go to therapy. I would imagine, depending on the struggle that a family might be going through, they might feel as if I need to say to my other family members, because it could be a situation that affects everyone in the home. So
exactly.
they might feel led to say that, but it's not necessarily they don't have to really say something like that, especially it's very confidential. It can
Right.
be something that's private. So it really depends on the situation that that person is in and that family setup. as well.
Yeah, because I would think if you're concerned that you look weak
Yeah.
or that people are going to judge you a certain way, then I think at least in terms of beginning the therapeutic
Yeah.
relationship,
Mhm.
you just start by keeping it private until
Exactly.
you grow um,
Exactly.
into the person who doesn't care as much, I guess, about. So you mentioned the lack of faith in the context of there are certain people who believe because they're religious or they have a certain relationship with God that to seek anything outside of the traditional um, I don't want to say
Yeah.
anything outside of traditional religion and scripture, for example, is a problem. How do you ever deal with those issues in therapy? How do you navigate that space?
Okay, so because I've worked in the church circle for a while as well, and it's really difficult to for some persons to really be very open and honest with stepping out of what they were taught. Uh Persons were taught like, hey, you have to be praying, and that's true. Reading your word, that's also true, to get through this particular issue.
Hmm.
When it's a real challenge for them, then they're taught that there's no other way. So it's really a struggle for many persons to actually go to that place where they're actually seeking therapy. And so when I work with individuals who have had that struggle or they're struggling, it's really building that therapeutic bond with them.
Okay.
And then they're able to recognize that, hey, this is a really place of safety for me, is a place of support. And when they're actually feeling that they're being healed, then they can also attest to the struggle that they had before, the prior belief. And some people do go back and they're sharing, because I've had some communities where people are actually going into their church circles and they're sharing, oh, therapy is something that's very helpful, and it's not a lack of faith. It's actually a step of faith to go out and to get the additional support that you need. So people are actually, I see there's also a shift, although we still have much work to do in that area.
Yeah. And so in terms of dealing with faith and whatever faith people bring to the table, how do you as a therapist or can you integrate their beliefs into the space? Are you allowed to do that kind of thing? Or is it tricky?
Absolutely.
I mean, yeah.
Yeah, absolutely. I
Okay.
mean, that's very important. You want to allow persons to exercise their own faith and their belief. You'll have some persons who believe in the power of meditation. That's really perfect for therapy, because you could use that as a way to help them to cope as well. You could give them, activities where they're actually meditating, where they're using nature, if that's a part of, their belief and their religion. So it really has a place, and I think it's a very powerful place if you can use their belief to help to guide their healing as
Hmm.
well.
If you can use their belief. I mean, I always
Yes.
wonder because I mean, we can't be in people's therapy sessions, but
Yeah.
I always wonder, like, if someone comes to you and they have some what we would think of as an outlandish belief. I don't know, they pray to birds. I don't know, whatever it is that they do. Um, are there boundaries? Are there places you cannot go in terms of people's faith? Like bringing their faith into the space, like if it contradicts, for example, I don't know, American Psychological Association standards or whatever. Like, is there ever a tension there?
It can be a tension
Yeah.
depending on how far it takes them. They might believe that it's okay to think that they can go as far as to kill somebody if somebody doesn't agree with their beliefs, and that's where
That's a little far.
that's a bit far. So
Right.
there's no, there's a breach of confidence where
Okay.
that's concerned.
Yeah.
If you're gonna hurt somebody else, then
Right.
I can't really, allow you to continue with that particular belief. I have to alert and make sure that
Right.
that person or other persons are safe.
I
So,
think it's the same across most professions, I
oh,
think. As I know, lawyers have a duty to
hmm,
report at least like fraud and
okay.
things. I don't know about priests. I think priests have to kind of keep it, right? I think I
Oh,
think anything you
good.
tell a priest, I think there's a
That's
confidentiality issue, whatever.
okay.
So you said so your background obviously is you have a background also in theology as well. So how did that work? So you studied counseling
Mm,
first, and then you went on to
yes.
what theology school?
Actually, yep. It was like a long road, and I wouldn't say that. Initially I found my place in psychology. Initially, I was really what we term as role confused. So I started off, even though I felt like I needed to be in a helping space, I started off doing or thinking of doing dentistry. That did not
Really?
work, because
Okay.
that was not me. So, I had to quickly think about something else. It was
Why did
nursing.
you? Because most people don't. I've heard of a lot of people wanting to be doctors. That's very
Yes.
general. You see that on TV, whatever. But in terms of specializations,
Mhm.
such as dentistry,
Oh,
why
yeah.
did you initially want to be a
I
dentist?
felt like I liked how my dentist operated, and
Okay, you had a good experience at the dentist.
I had a
Okay.
good experience, and it felt like something that, it seemed really nice to do
Hmm.
that. It was just so many things about it that I didn't like, and it was just not me. So I had
And
to,
how long did you hold on to the idea that you wanted to be a dentist, and then what caused you to let that idea go?
I think, right throughout the later high school days, I'm
Okay.
thinking about pre-college. I
Okay.
thought about that, and
Mhm.
then I thought about something else like nursing for a
Okay.
while. Then I landed in accounting and
So you
psychology.
were really
Yes, I was
trying
real confused. I was like,
all over the
that
place,
was
right?
it. Yeah, so that was not for me either.
Accounting was how could accounting be for anyone, honestly? I mean, this is not a hit on accountants or whatever, but I remember when I was in law school,
Yes.
I ended up taking a course called legal accounting.
Mhm.
Actually, the professor was Jamaican. This was
Oh,
the
really?
very, yes, last semester. And when I tell you, and I learned that a debit is a credit and a credit is a
Oh my
debit, and it was so illogical to me. It made no sense. I thought I was gonna flunk out like the last semester.
goodness.
All right, so you went from accounting, and then you ended up in
Yeah, I just kind of
counseling.
fell in love with psychology. I just did one course and that was it for me.
Okay.
This was me. I knew I had
Mm,
that desire or something to help people and just to kind of get to the root of people's problems or issues
mhm,
and to help them resolve it. So,
mhm,
that was where it all started for me.
mhm.
And yeah, I kept doing that for a couple of years. And
Doing what? The counseling work.
well, I did the counseling work
Yeah,
and then I started to officially study psychology.
yeah.
Yeah, for a couple of years. And then, yeah, that was pretty much.
And so, do you like the aspect of helping people, um, obviously, and talking to them about issues?
Yeah, yeah,
Yeah.
certainly. I love the idea of kind of working people through their issues. I just love seeing the change for me, the transformation of people's lives.
Mm,
I find a lot of joy in doing that and
mm,
just to feel as if I'm helping them to a better place or,
mhm,
a better version of themselves. That's what
mhm.
I think I like. And, I enjoy that from a long time ago. I just couldn't place it
Yeah.
at an early age, but I do enjoy seeing that.
I know because we were talking about stigma,
Yeah.
and that is a big thing
Mhm.
in certain communities, but not just we always think about like the Black community, the Caribbean community, but it's other communities as well. Not all communities, but um, and I wonder, and of course I just lost my question. Okay, so yeah, so part of the stigma is. I think people assume that when you go to therapy, your life must be completely messed up. Like you're just
Oh.
all over the place. Maybe you suffer from depression, God forbid, right?
Mhm.
But it's not always the case that your life is completely messed up. You just need a little bit of guidance to get to where you need to get to,
Absolutely
right?
so,
Yeah.
absolutely so. Because therapy can be long-term therapy, it can be short-term therapy. I might have just an issue for a short space of time. I've done grief work with a lot of people, so somebody dies and it affects them
Mhm,
for a while. It doesn't necessarily go on forever for some
mhm,
people, and people grieve just in different ways, as a
mhm,
matter of fact. So I might have that person for maybe a couple months,
mhm,
and another person who's grieving could be for a year, or it could be something that is just a couple sessions that helps to guide them or, help them through
mhm,
a particular situation. But that kind of professional support is necessary. But yeah, it's different for many different
mhm.
persons.
I always wonder about, especially when it comes to like grief, and it's not just grief. People bring a lot of
Yes.
energy to therapy. I always wonder what you all as therapists do with that.
Yes.
Like, where do you? Because you're taking on people's issues
Yeah,
every
that's
day. All the where's it? What do you do with that?
Yeah, so that's where the professional part of things is we're kind of guiding people, but we're not necessarily we're emotional beings, so you're really touched by people's
Yeah.
situations, people do have heartbreaking matters that they're navigating,
Mm-hmm.
and that's hard for you to kind of walk them through as well. But then you have to kind of protect and preserve yourself in the process too.
Mm-hmm.
So self-care is key. For any therapist at all,
Mm-hmm.
self-care is critical.
And what does that mean? Because
Mhm.
I know I've heard of some therapists who just have therapists,
Yes.
their own therapists.
Oh, yeah.
You know, is it critical that you have that kind of relationship with another therapist, or are we talking about different means of self-care?
Yeah, different means of self-care. I
Yeah.
think having your therapist depending on what you're also going through, because some therapists might struggle with the matter or situation, but because they're therapists that might feel, hey, I don't need help from anyone else. But then we're finding a lot now that therapists are getting therapists for themselves, depending on the severity of what they're faced with. They need work too.
Mm-hmm.
But self-care means just kind of making sure that you're not taking on everybody's situation that you're working with, that you're having those spaces where you're also healing, where you're replenishing, where you're doing everything that you love and enjoy. So when you go back into that seat as a
Mhm.
therapist, then you're free to help again. So
Mhm.
it's definitely a healing space that requires that form of prioritizing self-care.
Mm-hmm. Have you ever been in a situation where whatever's being expressed to you is I don't want to say too much for you, but it's just triggering, and
Yes.
you have to either discontinue the relationship, discontinue the session? I mean, does that ever happen? Or ever?
I've had cases like that, especially in my early years as a therapist.
Yeah.
I've worked with patients who sometimes get attached, but it's because of their symptoms. You
You
have
mean attached to you as a therapist?
yes,
Yeah, I would think that's a common thing between a therapist and the client.
yes,
Because, I mean, especially because a lot of people go to therapy, have
mhm,
never connected,
yes,
well, usually haven't connected with other therapists
right,
and with other people in such a deep way.
yes,
So now they feel safe.
mm-hmm.
And how do you deal with that? And
Yeah.
what does attachment look like as from the therapist standpoint? What does that look like? When is when is the client, I don't want to say they're crossing a line, but when does it become attachment that requires some sort of attention?
Yes. So as you mentioned, attachment, it's fine to have attachment
Okay.
because you want to build that therapeutic bond, of
Okay.
course, with your therapist, and it's okay.
Yeah.
Because once you build that relationship, then they're so open that they're just kind of talking to you without even realizing how much they're opening, and that's their healing. That's healing for them,
Hmm.
being very open and honest with whatever they're faced with. So I
Hmm.
think it's very important to build that. And you don't get that necessarily with all patients. It takes a while. So people have to actually choose the therapist that they feel works best with their situation as
Hmm.
well.
Hmm.
It can become a problem. And in some cases, you might have situations, as I mentioned before, where you have unhealthy attachments.
Hmm.
So healthy attachments, it's perfect, it's fine, it's normal, and it's actually what helps with the healing work.
Hmm.
But then you have those, random cases that you'll find patients are like, you have to set boundaries with them. And I think that's where the skills come in. And
Like what are they doing that makes you think, is it what they're texting you late at night? They're trying to make sessions last longer. What are some of the things that people do that?
yes, and yeah, people do things when it's coming out of their pain too. Sometimes they
Okay.
feel as if you're there to help them and support them,
Yeah.
but they might want to, as you mentioned, extend the time with therapy. They might want to go on for hours. They might want to depend on you to do the work.
Hmm.
So they might have homework assignments, but they're trying to depend on you to kind of make it through whatever they're faced with. So you have to set boundaries in different ways. Maybe the time that you're making the connections with them, they might not want to, they might be upset with those kinds of boundaries as well. So you can see different things might be going on with a particular patient as well. Because I've worked with borderline patients, and they
When you
do,
say borderline, what does
yes.
that mean?
So you have persons with a particular
Oh,
personality
personalities.
disorder.
Okay. Okay.
Yes, and that's a part of it. So poor insight into their behaviors. They might be very upset with you as a therapist. They want to have your entire time,
Hmm.
but they might not accept the fact that, hey, we're doing therapy once per week and we're doing
Yeah.
this for 45
Sure.
minutes. So,
That's because it feels good to a lot of people to start connecting that way. They've not never connected that way
Yeah,
before.
that's absolutely true.
Yeah, and you're like, yep, but there are boundaries.
Yes. Yes.
This is interesting. I remember, and I may have shared on this podcast that I've had therapy before,
Yes.
and I remember I had a therapist who, and I don't remember what the reasoning was,
Mhm.
but he came to my birthday party. It was a party, and I remember asking him, "Is that appropriate?" He said, "It is. It's okay because of whatever we're dealing with at the moment. However, at the party, I can't really engage with other people, and I definitely cannot disclose who I
Okay.
am." You know, so but it was really interesting because he came to the party
Yes.
and just kind of sat in the corner
Oh,
and didn't
wow.
engage with
Yes.
anyone. Asked me to get him a plate. Like, this is really looking weird, you
It's
know.
so odd.
But those kinds of things,
Yes.
I guess it's up to each therapist to kind of figure out how to navigate the
Yes,
situation.
absolutely. And depending
Yeah.
what's going on with
Mm.
you and your patient, then you
Mhm.
have to be able to navigate and ensure that you're doing actually professional work and there's nothing unethical that's happening. So setting those boundaries and also maintaining those boundaries, especially for difficult clients, it's very
And
important.
letting them know what the boundaries are in advance.
Yes, because
'Cause it's
some you
not,
have to
yes.
remind them as
Okay.
often as it's
Yeah.
necessary. So that's,
Yeah, because they
it's
start to feel like a friend. You're like, oh, you want to dance? I'm like, no.
absolutely no, absolutely not.
Wow. And I always wonder also, I would imagine sometimes, I'm not saying with you,
Mhm.
that the therapist may want to, I don't want to say cross the line, but may feel a particular affinity or affection toward the client.
Mhm.
Not romantically. I'm just saying in terms
Yes.
of like, yeah, I'd go to coffee with this person,
Mhm.
but maybe I shouldn't.
Yes.
Have you heard of that ever happening with
Oh, yeah.
other?
Oh,
Yeah.
yeah, that's definitely that can happen. As humans we do get attached, and sometimes it's important to you have those spaces as well. You might have a supervisor, somebody kind of discuss those issues with as well,
Hmm.
because you want to make sure that you're maintaining professionalism and it's
Hmm.
not necessarily anything that will affect the therapeutic relationship with you and your patient.
Hmm.
So that's very important.
So I want to talk about post-COVID because you mentioned that. I think before we started recording, a lot has happened. Well, particularly we're taping in New York right now,
Yeah.
so a lot happened here, but a lot happened other places too, um, and it was a really difficult time for the country
Mhm.
and a really difficult time for hotspots like New York City. And I can't even
Yes.
remember other hotspots, but any urban area, particularly where there are a lot of people of color, people at certain economic strata. Um, and it was a scary time
Mhm.
for many.
Yes.
And so a lot of people ended up struggling. And I don't know if mental illness, it seems like mental illness became a much bigger deal
Oh,
post COVID.
yeah. Oh,
Would you say, is that
absolutely.
accurate?
So, yeah, you're
Yeah.
right with that one.
And why
Uh,
why is it that people didn't have the capacity to deal with that kind of I mean, it was a pandemic,
mm,
obviously.
Yeah.
Once in a lifetime for most
Yeah.
of us. But what is it that exposed that mental illness? What is it about COVID that did that?
It was a period of the unknown for a lot of people,
Okay.
and people were suffering and they did not know, what would happen next. And that
Mhm.
was scary for a lot of people. It was traumatizing for many.
Trauma.
So, yeah, so people had to find a way to deal with that. A lot of people's lives were changed. A lot of people's lives are still, they're still
Yeah.
trying to get back to some form of,
Really?
normal pace. Since COVID, it's changed for so many people. It's never the same.
Really?
So, yeah,
And so you've seen that in your practice. Obviously, you probably got
yeah.
more clients during that
Oh,
time as
yes,
well, but
sir.
also some of the clients you had already probably experienced a certain amount of trauma
Hmm.
as a result of that.
Yeah,
So a
definitely.
lot of it is the unknowable.
Yes, definitely.
And then I imagine some people experience death.
Yes,
I mean,
that.
I certainly did
Hmm.
in my family. People died. I mean, and it's weird. I remember it's very odd because I mean, I didn't experience death in my family in a real way, meaning like I went to a funeral until like 35.
Okay, really?
Yeah, not until I was like 35 years
Oh,
old. So I remember going and to this funeral was I think for a cousin, um, and there were no traditions established because we had
oh,
not done this. We were
mhm.
fortunate enough to have had weddings, sweet 16s, because my parent, family's from
Yes.
Guatemala, so we do sweet 16,
Mm.
baptisms, all kinds of
Yeah.
wonderful events.
Wow.
But there was no template for what to do
Mm-hmm.
at a
Hmm.
funeral,
Yeah,
you know,
and
and
that's
it was
scary.
Yeah.
That's scary. And
Yeah, yeah, yeah. But anyway, that was just a
yeah.
side note that I was going to connect. But
hmm Great
yeah.
side note, because I think that's exactly what COVID did. It was
Mm,
a scary time for a lot of persons, and people are still reliving that trauma with, anything that happens, crisis wise, or anything that's going on. People are remembering that time of confusion, of not knowing what to do,
mhm.
and just being in so much pain and suffering for the world. So that's it was a difficult
It
time, and
was.
people are still trying to make it through from that today.
That's great. Yeah, I want to pick up on that too.
Mhm.
But this is what I'm remembering now. So I remember there was a period during the height of COVID
Yes.
where I'd be at home. I was with my mom during that time for a period, and the phone ringing, and almost every time there was news of a death of someone we knew, or someone we knew who knew someone who, or some bad news.
Mhm.
I never. It's almost like, I mean, I haven't been in war, I haven't been in the military, whatever. But it's almost like, wow, like
Mhm.
it it it. I wouldn't say I got desensitized, but
Mhm.
for a period, it was like when the phone rang, it was like, oh, who died
Yeah.
today?
Yeah. That was it.
And some of us were dealing with that kind of thing, and then there was a whole population in the United States who was oblivious to that. They just kind of watched the news and
Yeah.
didn't really have a full understanding
Okay.
of what that was. Yeah, so if you've dealt with that kind of trauma, how do you begin to sort of pick the pieces, put the pieces back together for yourself?
Yeah. So living with trauma is it's very hard. It's almost like that pain that never goes away.
Really?
Yeah, it really is. So for trauma, it's you really need trauma work. And I would
Mm,
highly recommend anyone who's experiencing trauma, reliving the experiences of maybe COVID or something that happened in their life or childhood days. Because that's what trauma does. They're reliving those experiences in dreams or, conversations or
oh,
triggering points that you see something that just really reminds you.
mhm.
Maybe even hearing that phone ring, you could
Mm,
remember the death, the things that happen in your
yeah.
family is just a strong trigger for you. So I think with trauma, it's important to get real professional work,
Mhm.
get that therapist who can actually help you navigate those experiences, especially if it becomes interfering. It's
Mhm.
interfering with your life, it's interfering with everything you do or your goals. It really requires a little bit more work than you just trying to make it through from day to day.
Really?
Yeah.
Do you find, and that's interesting because obviously a lot of people dealt with trauma.
Yes.
Most people didn't go to a therapist. So what are people doing to deal with all of that trauma
Yeah.
when they're not dealing with it
Yeah.
in a professional setting? How does it show up?
Well, the truth about trauma, if you don't deal with it, you will deal with it. It will show up at some point. So
Okay.
sometimes it's just kind of like finding ways to cope with it. But then you might have a situation that,
Mhm.
you're remembering this thing from 10 years ago and you're
Mm.
kind of like, it starts really affecting you because you've never really, it was just hidden for you. It's like a cover up.
Mhm.
But it really requires you to enter a space where you can actually work through it.
Mm.
I think that's key to trauma because it's going to be there. It can affect you. It's going to be there. If you're living with it and if you don't believe in trauma work, then you might just survive. And I think
Yeah.
a lot of people do, yeah, may survive it, but depending on what it is, it's highly recommended that you try to deal with it.
What percentage of people in the country, for example? I mean, because I think, for example, obesity is an epidemic
Mhm.
in the United States. And I was just recently thinking about this. I don't know if it's true, and I got to be careful here. But it would appear that there are a lot of people in the United States who are dealing with some sort of mental illness, and maybe perhaps they're not,
Mhm.
you know,
Yeah.
aware, and it can affect their decision
Mhm.
making, who they support, for example. Um, politically, you know what I mean?
Yeah.
And I'm just wondering, how rampant is mental illness in the United States?
It is. It
Yeah?
is pretty rampant.
Yeah.
I mean, you would find like maybe 1 in 10 or 1 in 5 persons who are really truly suffering from some form of mental illness.
Yeah.
So it's definitely
What do you mean
there.
by truly suffering though? Like does it have to be like really bad, or could it be a touch of, I don't know, anxiety? I mean, is it,
Um, it can be really bad.
yeah,
Not necessarily something that they're actually struggling.
sure.
They're struggling with something. For some persons, they don't really know what it is, but they find that, hey, I'm tired more than usual,
Really?
or yeah,
So
and
mental illness shows up physically, it manifests
oh
physically?
yeah, it's really shows up in different ways. Because
What
I
are those
might,
ways?
yeah, so I might be struggling with depression and I find myself I'm more exhausted than
Okay.
usual.
Fatigue.
I really want to isolate. I don't have the desire or the energy to have friends around me.
Hmm.
I'm doing things just totally differently than what I'm accustomed to. So I find that I'm struggling through the day. And so that's, that's definitely one of the signs of feeling a depressed mood. And
Hmm.
maybe it's new for you, so you don't really know what it is.
Hmm.
But if it keeps going on, then you recognize it's affecting me. I need
Hmm.
to do something about this. So you'll find that you'll find a few persons or many persons actually having this kind of a struggle.
Hmm.
Depression, anxiety, and especially now, people are struggling so much with anxiety.
Why?
Um,
Why? Is it because of what we were talking about?
yeah, what
Oh,
we're
right.
talking about.
Yes.
People
Why are
just,
people anxious?
like, people are anxious. This is on, well,
Well, people are anxious for financial reasons.
yes,
Obviously,
financial
there's a
reasons.
lot of division in the country. We can
There's a
see
lot of
that.
division
Yeah.
right now.
Okay.
There's a lot of tension and a little
Mm.
bit of confusion. For some people,
Yeah.
they're like, it's
And that is actually touching people's lives mentally. You see
it
that.
is,
Wow. That's powerful.
and it could be a pandemic in a new kind of a way, in a
No,
sense where
really.
yes, it can be. I think, we're gonna have a lot of people again, just like we did, coming to the, or to their therapy sessions again,
Yeah.
searching for help, searching for support just to kind of make it through. Because some things are in fact very painful to go through, but you feel the effects of it after the fact. So
Hmm.
while people are going through these things, I think after the fact they're gonna, you're gonna find a lot of persons just kind of slowing down, and this is affecting them. They can't move on until they get some needed work.
Mm.
Yeah, absolutely. So
Um, yeah, that's interesting. I know you've done work in the area of anger management.
yes.
Um, I- how does that play out in today's context of what, because there's a lot going on politically, socially, or whatever. Are there um is there a rise in, anger issues? I mean, does it have to be do people have to work through anger more so than before? Are you seeing any changes there?
I'm seeing people getting angry. I wouldn't say that I could put maybe stats on it yet. But I'll be able to at some point, maybe in the future, just to see, what's happening if there's increase. But yeah, you've a lot of people are struggling with frustration. Like,
Mm.
they can't get the answers they need. Things are happening beyond their control. They can't do anything about some things that are faced with today.
Hmm.
And that's causing them a lot of anger. So,
Mm.
you find that, I kind of leave that very open for persons who come to the table to speak about their concerns. And for some, it is actually the depth of anger associated with what's happening in today's society. So,
Mm.
yeah, it is a thing.
There is definitely a lot going on in the country
Yep, there's a lot.
politically. There's definitely a lot of division.
Mhm.
And so there is an area I wanted to discuss within the context of mental care or
Yes.
illness, even, and that's immigration. Oftentimes, when we talk about immigration today, it's about, what side are you on in the border and all
Mhm.
that. I don't want to necessarily focus on that, but
Right.
I'm interested in knowing, because we're here in New York City, and so we deal with
Mhm.
all sorts of immigrant populations.
Okay.
If you are seeing anything in particular in immigrant communities in response to what's happening in the country mentally, like,
Mhm.
can you talk about that a little bit?
Yes, so it's always the case, even before now, because this population, immigrants, they're very sensitive.
Mm.
There are so many things that immigrants go through, and it's almost like they're isolated, or they do not get the kind of attention sometimes that they really do need.
Hmm.
And especially now, it's a lot more intense, and you find that a lot of immigrants are just they're struggling so much. And so, right here. in New York, we, as you mentioned, we have to find ways to support each other, to
Mm-hmm.
encourage them.
Mm-hmm.
So it's um, helping them to enter into spaces that they can actually get the help that they really need, to get someone to talk to kind of prioritize, encourage them to prioritize things like their self-care and things like that. So yeah, so we do have really have a lot of that happening
Mm-hmm.
right now, and more than usual as well.
Yeah, I would imagine if you're an immigrant, particularly if you're undocumented, for
Yeah.
example, but
Yeah.
not even necessarily, because you could look like you are,
Mm-hmm.
whatever that means,
Yes.
that there would be a certain amount of anxiety. And it's not just I think most people think, oh, the fear is someone's going to like burst into your home and take you away.
Right.
Or I guess today, go to, I don't know, a local supermarket and take you away, or
Yes,
go to your
yes.
church. But but it extends to other family members too, because you have
Yes.
immigrants send their kids to school,
Yes, yes.
right? And they have to be concerned about, maybe their kids being harassed,
Mm-hmm.
maybe their kids being forcibly taken
Yes.
out of the environment, or maybe the parent or parents taken away and then the kids left at school. There's so many layers to
Yeah.
this.
There's
Yeah.
absolutely so many different angles to this. Families are being affected
Mhm.
mentally. Parents are worrying about their children. There's so much anxiety related to all the things that they're faced with today, and
Is it more palpable than it's been before? Like, do you feel like this is a thing?
it definitely
Yeah.
is.
Mhm.
I think this is really intense for a lot of
Mhm.
persons. They've never seen this kind of an impact for
Mhm.
and so it's a lot of worry for children.
For children.
A lot of children are flustered and kind of wondering like what's going to happen next to my family, my
Yeah.
parents,
Yeah.
or even an extended family member.
Mhm.
So it's trying to keep those young people very calm and trying to help them through. It's very difficult though for them, but just helping them to feel that they're supported
Mhm.
regardless of what everything else says to them. We want to genuinely support and be there for them,
Mhm.
so that they feel as safe enough
Mhm.
in this
Safety is
difficult
very
time.
important.
Safety. Mhm.
Yeah, and this is assuming they're getting treatment.
Oh
I would
yeah.
imagine a lot of immigrants aren't necessarily reaching out for treatment
Yes.
or even know how. You know what I
Mhm.
mean? And so, what are they to do? I mean, are there resources out there for um, individuals who are, particularly anxious during this time
Mhm.
because of
There
their?
are several
Yeah.
resources
Hmm.
out there to help immigrants, and I know in a lot of communities, especially church communities, there are programs geared towards supporting immigrants now more than
Mm.
before. You have open path therapy. You have a lot of therapists who are also immigrants themselves, and they're able to extend and support immigrant families or communities. You do have also there's some other resources out there
Hmm.
that you could actually, you know, I could actually share.
Hmm.
Yeah,
Yeah. No, if it's and we'll probably add that
yeah,
later, because I don't expect you to walk around like
yeah.
remembering all of that. In our pre-interview, we talked. Yeah, so I've worked with the, and it's not. I've worked with the population, I
Yes.
think, that you have worked with, but in my capacity as a lawyer, because I've been a guardian, and a guardian ad litem, which basically means that I went to court and stepped in the shoes of the people I was representing because they had no voice for themselves,
Oh yeah.
and no family members. Many times these people were either in nursing homes,
Mm.
they were in independent living situations, um, and some of them lived on their own,
Yeah.
but there was usually some sort of care team and a whole
Oh yeah.
um, thing around them. And I'm not trained in
Yeah.
mental illness or anything like
Mhm,
that.
mhm.
But now looking back, when I did this work, I would say that was definitely an issue.
Yeah.
It was one of, we always focused, or I did, on
Yeah.
the physical,
Yes.
focused on getting the correct services
Mhm.
for the clients, Medicaid and that kind of thing. But mental illness was always a part of it.
Yeah.
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 And that, how common is that? That it's just, it's one of the issues
Yeah.
that's on the table? Is
Oh,
that
yeah.
like a
That's a big issue, and
yeah?
there's still like it's a there's we need so much more work in that area.
Hmm.
There's so many persons who are suffering emotionally and struggling, but we don't have enough therapists, we don't have enough
Hmm.
psychologists, so we are understaffed grossly for the amount of work that's needed out
When you say
there.
we, you mean just in general, there's not enough therapists out there to
Yes,
serve the
in
people?
in general, there
Really?
is a shortage of
Is that
therapists.
right?
That's right.
Oh,
It's
wow.
really so. That's the
I
case.
didn't realize that.
Oh,
I
yes.
thought there was a shortage of clients because there's so many people who don't want to go.
Yeah.
But you're saying
And
people
those who
want,
do,
yeah,
there's still a shortage of you know, therapists
yeah,
out there for
yeah.
those who do want to go.
I
So
think
it's so much.
I
Yeah.
think a lot of times the issue is people want to feel like they can relate to their therapist.
Yes.
And oftentimes, not always, but a lot of times people want to meet with people who look like them or may have had similar experiences or may speak their language or maybe of the same faith. And I would imagine that that's an issue too. For example, I'm a black male.
Hmm.
You know what I
Yes.
mean? There aren't a whole lot of black male therapists out there,
That's the thing.
right? I mean, and it doesn't mean I can't see,
Hmm.
other types of therapists,
Yeah.
but there are black men who want to see black male
Oh, yeah.
therapists.
Yeah.
Just like there are women who want to see female therapists.
Yeah.
You know what I mean? And I would imagine black women or,
Hmm.
Hispanic women, maybe, you know what I mean? So,
Yes.
yeah, I mean, can you speak a little bit to that? Like,
Yeah. So
yeah.
that's absolutely the case. People
Mhm.
really do want to connect with somebody who they feel looks like them. They might have similar experiences and so they can relate.
Mhm.
So that's also it makes it more challenging to get
Yeah.
the right fit. So
Mhm.
people are, you might not necessarily find a lot of maybe black therapists in a particular community.
Mhm.
So, rather than searching, I'll just maybe deal with my issues by myself because I
Mm.
cannot find somebody who I can actually connect with. And it may go back to the resources. You do have few resources out there that people don't know about. You do have therapy for black men
Mhm.
today. You have therapy for
Yeah.
black girls, and you have things like open path therapy as well that they offer services to minority groups and things like that. So those are, people don't know about some of the resources that are actually there,
Yeah. I think
but
what
that's
hap
a challenge.
I think what happens is sometimes the client or potential client, they don't want to spend time having to educate the therapist about their cultural
Oh, yes,
context. You know what I mean? Because
yes, yeah,
that's like half of it. And
yeah,
then by the time you
exactly.
explain why you do what you do, it's interesting. I remember, I don't know where I saw this. I feel like it was Denzel Washington
Mhm,
talking about the importance of, dare I say it, diversity
mhm,
in the motion picture industry.
mhm,
And in terms of directors and things like that. And he was like, there are many, many fine directors, white, black, Asian, or whatever. But if you're doing, I think this is what he was talking about, like a movie about, African Americans, um, and you have an African American director versus, a director from some other background.
mhm,
It's not that both can't direct, but
mhm.
maybe perhaps the African American director may have experienced, for example, the smell of a hot comb
Okay.
in their home when
Yes.
they were really young, which is so
Yes, that's really
brilliant. I'm
good.
like,
Yeah,
yeah, because my
that's a good.
sisters use the hot
Yeah,
comb,
you
and
can relate.
you're not going to write that into a script if
Mhm.
you've never experienced it. Why
Yeah,
would you have experienced it? And
yeah,
why would you know that that's a thing?
yeah,
You know what I
exactly,
mean? So I
exactly.
always think it's the same thing in almost any profession, your profession, the
Mhm.
legal profession, which is
Yes.
only 5%
Mhm.
black.
Oh, really?
I think it's
Yes.
the least diverse profession in the
Oh,
United States.
oh gosh.
Yeah, yeah,
Mhm.
yeah. So there are a lot of people out there who have people in their family who suffer from mental illness, and it may not be diagnosed,
Mhm.
but you know how it is in a lot of families. People talk about these things, and
Yeah.
behind the scenes, I think so and so's a little,
Mhm.
or off or whatever. I mean, what kinds of practical steps can people take to assist loved ones who may be struggling with issues?
Yeah.
mental issues.
Yes, I've had that, come up a lot with a lot of people and families having those loved ones who are struggling with severe mental illnesses and stuff like that. So it's very difficult for other families to see the suffering, but they're also not able to, deal with that family member. It's difficult. Maybe they're shouting, maybe they're becoming aggressive, maybe they're hitting, doing something that, that causes a lot of pain to the family. So people are struggling like, how do I live with this? Am I supposed to live with this? What am I supposed to do? Where do I go from here? So I think one of the things that people, can do, first of all, you have to get support for this particular family member.
Hmm.
Um, I would encourage persons who are having those difficult experiences with their family members not to engage them too much, like in terms of, well, engagement has to be truly positive,
Hmm.
but don't try to fight with them. Don't try to, if they're saying something that's maybe irrational or
Hmm.
psychotic,
Hmm.
don't try to contest them. Don't try to, get into it too much with them because it might make matters a lot worse. So,
Yeah.
it's very important that you recognize things for what it is. You're dealing with this person. It's not working out as a family. They're, everybody's drained in the home, so we have to do something. So get into family therapy. Find some
I was
help.
about to ask you because that's a really sensitive thing.
Yeah.
At some point, we're getting to in my mind, you got to see a therapist,
Yes.
but not so.
Yes.
We
We have
to
to
go. Okay,
go.
yeah,
Yeah, absolutely. Because it's
I love
affecting
it.
the unit. It's affecting
Sure.
everyone in the home. So it's
Yeah.
best that we all go.
Yeah.
And some persons need to be educated
That's
as to what's going on. So it's great to go into that setting to kind of get the, that valued support.
And it's always, people who feel that other people need to go to therapy, they often think that the problem is with the other person.
Yes.
And then sometimes, they're part of the problem. So family therapy
Yes,
is
absolutely.
definitely. Now, what if you're dealing with, because there are obviously different diagnoses, different kinds of mental illness, and you can't put your finger on it. Sometimes people just have personality issues,
Yeah.
and that may be an issue, a mental issue.
Yeah.
And it has historically affected how they engage, not only with the family, but just, with people on the job, people in the community. Is it harder to engage those people? I mean,
Yeah.
and bring them into a place where they can be helped.
Yeah. It might be a lot more difficult
Yeah.
to
Because some
engage those
people, I'm
persons.
sorry, I don't mean to
Yeah.
interrupt, but some people have been told their whole lives, you just have a bad attitude, or, people don't, or they believe, people don't like me because I speak my mind. You know what I mean? And
yeah.
oftentimes, no, it's deeper than that. That's what I mean. It's like, how do you
Yeah.
get to the realization that no, this is something else?
Yeah. So that's a big challenge for a lot of
Mhm.
families. So what's perceived as, I just speak my mind and this is who I am. It could be something else. It could be it could be a borderline personality, a bipolar personality, it could be a narcissistic personality, somebody who has poor insight. They're not seen, they're seen, they're not really seeing their, how they're affecting other persons. They're not seeing themselves really. They're so much in love with themselves, or they just want things their way, but it's a part of their symptoms really. And the fact that they have this poor insight, it is a challenge for other family members trying to explain to them, no, you said this or you did this. They're like, no, I did not. You did that, so that becomes a challenge trying to get that person to see that, hey, they need support. Or so you have to kind of perhaps use creative means or some strategies to,
Take this pill, fall asleep, take it to the doctor. No.
That's it. And that's the power of relationships too. If you could get somebody who you feel that they relate well with, certainly they do have difficult relationships with pretty much almost a lot of persons. But if you could find somebody that could help to motivate them to, hey, this, we could just try this as a family, just to see if this works for us. But never give up though, because I've seen families who eventually they're able to help somebody who is struggling with a personality disorder to kind of work through it. But it takes a lot of difficult, intentional work
Does
for
it
them to
involve
get.
medication necessarily?
Most
I mean,
days it
yeah.
most times that individual really needs some form of medication, just is especially if they're not stable enough. If they have other things, other symptoms like psychotic symptoms, they perhaps need some medication. So yeah, so it's great if they can get their individual work along with the family therapy as well. So that's important.
When we're talking about things like personality disorders, like I think histrionic personality, is that the thing? I think I read that somewhere. Histrionic personality disorder, narcissism, whatever, is the biggest challenge getting the individual to have insight into how they present to the world. Is that the biggest thing? And then working through that?
Yeah,
Yeah.
that's the biggest thing, and because that's what they struggle with really. So you might never get them to that place where they have full insight into their actions, but you can help them to to cope. Their skills that they could use to actually cope with their emotional dysregulations, and also to help them when they're upset and angry with the world. They have skills that are designed to help them to actually cope, really. So you might not get them to have that insight per se, that full insight. You might help them to some extent, but because that's a big part of their symptoms, you might find the skills are better for them. Yeah.
So the name of this podcast is Frolic and Detour, and it's premised on the idea that people evolve over time and find their way through different paths, careers, which is what's happened in my case. And in your case, to a degree, you talked about going through accounting, I think nursing, dentistry, or at least playing with these ideas. I'm wondering, is there anything in your background as a younger person that, looking back now, you think would connect to your current day experiences? Were there signs that you might end up doing the work that you're doing today?
Yeah, I could clearly make that
I've
connection
seen that.
with them.
It's always 100, right? When
Yeah.
you say hindsight is 2020, and yeah.
Yeah.
Okay. So well, so you grew up in Jamaica?
Yes, I grew up in Jamaica,
Okay.
and my family, I came out of a home with parents who were there, always community parents. They were always giving, they're always helping the children in the community, giving lunch money for those who need to get to school. I saw my dad do that so many times, helping people through college. My parents did that.
Oh, wow.
They were always giving parents and sharing, so that became a big part of who I am. That felt like home to me at all times, just to see someone in need and just to be supportive and just to help people navigate. I've seen it with my mom, difficult problems. I've seen her help from a younger age. People go through their situations, talk them through it, help them through it, and give them things that they need to get to a better place. So for me, it was so natural when I found my true passion in psychology, because that's healing work. That's helping people to get to a better place, a better version of themselves, helping them to get the kinds of support that they need to get there too. So that became very real to me, and just that it brings me life. But it started from way back when. Yeah.
And so, and today, so you mentioned earlier on that in addition to the work that you're doing in your own practice, I mean, sometimes you're called to speak at events.
Yes.
What kinds of events have you spoken at?
I've done quite a number of events
Yeah.
so far in the church community, because
Okay.
again, we're breaking barriers and stigmas and helping people to, see the impact, or mental health awareness is a big deal. So I've done that a lot. And I do have my own little YouTube channel where I speak about mental health tips and
didn't-
things like that.
I didn't notice. How did we miss this?
Yes. Yes.
Okay.
So those are the things,
Yeah.
those topics that people need to hear a little bit more about. I talk about that as well. And I've done presentations at workshops. I've done some in Texas and other states. As well. Stress management tips for people on the jobs and things like that. So I've done quite a number of variety of presentations in workspaces, in schools, and also in other communities as well.
So what would you say your vision is for the field that you're in? Like, if you could snap your fingers and, I don't know, we're 100 years from now, what would you like to see um, different
Hmm.
in the field? Like,
Hmm.
what kind of progress would you be looking for?
I want to see a lot more persons in the field of psychology. I want to also see a lot more persons feeling free to access the resources that are there and to break down all the barriers that prevent them from actually getting help that's
Hmm.
needed.
Hmm.
And I want people to just be able to be healed from all of the things that they're faced with and find the freedom of accessing those tools that are necessary for healing. Whether it's online, more workshops, more events, more community events that target mental health barriers and
Hmm.
all these things. I want to see a lot more of that happening as well.
Hmm.
Yeah, for families and
And do you feel
individuals.
we're making inroads in the church community, for example, with regard to the acceptance of the idea that there is a space for mental help with issues
Mhm.
alongside kind of, faith?
Yeah,
Are you
yeah.
seeing that? Like, is there still a lot
I
of
see.
tension?
There's still some work to be done, but
Hmm.
I think we've come a long way. I've
Yeah.
seen people like kind of encouraging a lot more of this and
Hmm.
inviting me to speak about this in different
Hmm.
churches. So I find that this is something that it's getting, and especially as you mentioned, post pandemic, people are just
Hmm.
kind of seeing and realizing that we do need support, mental health support, and it's a lot more than what we thought it was.
Hmm.
So yeah, absolutely.
So I asked you about what you envision the field of what an ideal situation would be for the field of psychology.
Mhm.
What's your vision for yourself, your practice? Where do you see yourself? Obviously not 100 years from now, but 10 years from now. Where would you like to be?
Okay, so I definitely want to just kind of have multiple
Yeah.
locations and have people in the field. I want to mentor a lot of young people
Hmm.
into this field, and I just want to see the mental health my practice grow
Of course.
significantly. I
Yeah.
also want to do a lot more work in the Caribbean
Hmm.
because I know that there's still a lot of need for mental health work there. So I want to make sure that I'm also making my contribution to the Caribbean as well. I want to do a lot more workshops
Hmm.
and, making my presence known all over in terms of like not necessarily my presence, but the work that's needed to help people who have little limited access
Mm.
to the resources
Mm.
as well. So yeah, definitely. Yeah.
So for people who want to follow you, get to know more about you, I know you've written a couple of books, which we didn't get to. I think
Mhm.
it was one or two books, I
Yeah.
believe.
Okay.
Where can they find you online?
Okay. So they could just Google Hope Behavioral Care Dr. Roxanne Richards, and they'll see me pop up, and then they'll can see my website. They
Okay.
see all the work that I do, and if they need to, reach out for an event or something else, they could just kind of send me a message or something. Also, I'm on TikTok and YouTube, so
You're on TikTok too? TikTok doc.
yeah, so
I
yeah,
didn't realize that. Okay.
yeah,
Awesome.
so I'm there too. So if they want to, connect or reach out or see what's happening, they can actually connect there too. So that's
Okay.
fine. Yes.
Dr. Roxanne Richards.
Yes.
Thanks
Thank
for
you.
coming on to the podcast.
It
This
was
has been,
awesome.
yeah, awesome. All right.
Yes. Thanks for
Take care.
having me.
Yep, absolutely.
Okay.
And thank you for watching Frolic and Detour podcast. We really appreciate your support. Please check us out at frolicandDetourpodcast.com and feel free to like, share, and subscribe to our podcast. And thanks for watching.